that. Everybody online is in. Thank you, the interpreter. I appreciate that. Good afternoon. Welcome to this is DDA's listening session. So is everybody in the right place? Yes. If not, there's also a church service going on next door if anybody feels so inclined. So welcome. I am so glad we have a jammed packed 2 hours that we are together here. First, I'd like to introduce myself. My name is Renee Averett Sanzoni, and I am with the Parents Place of Maryland, which is Maryland's special education, health, and behavioral health statewide nonprofit that supports families across the state. And I am going to be your facilitator for this evening. Oh, my apologies. We're waiting to pin the ASL interpreters. My apologies. They are pinned on my screen. So give it a moment. Oops. Technology's great, isn't it? When it works. Yeah. Yes. Okay, so one thing we're going to do while we're waiting for the interpreter to be pinned, because you guys are all here in person, let's do a quick important housekeeping. Restrooms. All right. So if you go out the doors, there are a set of restrooms to the left, there's a set of restrooms to the right, and you meander around and follow the signs. And so if anybody needs that, wanted to make sure that you guys were all aware of that. So I can at least take care of that piece while we wait. Yes, we're good. All right, let's try this again. Take two on getting started with the meeting. And so since we are starting 10 minutes late, we are going to go 10 minutes over to make sure that we have the full 2 hours that we can hear everyone's comments in this room, in the overflow room, as well as virtually with our folks with us this evening. Dr. Smalls, do you want me to advance the slides or are you good too? Oh, all right, we do have closed captioning available for those of you that are online. So make sure that you follow the instructions for the captioning with the two little C's there at the bottom. It's not always exact, but it really does do a pretty good job with closed captioning. So please make sure you turn that on if that's what you need. Next slide, please. All right, right now, mics and cameras are turned off for our virtual folks, and you're in listen only mode. But when it comes time for comments, you will raise your hand. Also, please make sure that those of you that are online, that you are typing your comments in the chat as well, if that is easier for you to do that. You will see here that you can also click to download the attachments for the presentation. Well, it's not really a presentation, the slides that are being used today. So that is also going to be available for you. Next slide, please. All right. We've already talked about this. Is what you're going to do is you're going to be, so we're not doing questions today, we're doing comments. So for folks in the room, in the overflow and online, as we ask the questions, this will be your opportunity to share comments in response to those questions. All right, next slide, please. All right. And like we said, you'll have the option for our virtual folks to raise their hands to ask to share their comments out loud. For those of you that are here in this room, same thing. Please raise your hand. And we've got the great DDA folks that have microphones that will make sure they get them for you. Those of you that are in the overflow room, I'll make sure that we rotate in. And if you have questions, we'll make sure that those will also get, your comments will get collected as well. Next slide, please. All right. So we do know very much that this is a very emotionally charged time that's going on, and DDA is doing a lot of redesign work. And so we really do want to really talk about the fact that we do want your comment, but we really want to have a certain code of conduct. So please, we want diverse viewpoints. It's very important that we hear all of the comments from everyone, but we really want to make sure that we're doing it with dignity and with respect. So if there is some uncivil behavior, any sort of actions, abusive language, threats or harassment, it will not be tolerated and folks will have to be removed from the meeting. So please, let's not do that, okay? Because we want to make sure we hear, because if that happens, we're also getting into other folks' comment time and we want to make sure all the voices are being heard. Right, next slide, please. So we are, oops, back one, please. Thank you. There's a delay on that. All right. So basically what we're talking about is one voice at a time. There really is a 2-minute limit on your comments. So there is going to be a timer. All right. And I will have to cut you off if you go over the 2 minutes. So please don't make me do that. All right. So that we have time that we can have everyone's comments and definitely listen with respect. And we want to avoid any sort of interruptions, honor each speaker's perspective. Please keep the sidebar conversations to a minimum so that we make sure that we're collecting all of the comments because they are being collected. So again, welcome to DDA's community session. I'd like to do a brief introduction. I'm sure the folks behind me need no introduction, but just in case. So Deputy Secretary Marlena Hutchinson.
Good afternoon, everyone. Thanks for joining us today.
All right. And Chief Operating Officer Robert White.
Good afternoon.
All right. And Chief of Staff Allison Wool. All right. So welcome and thank you for being here. All right. We're about ready to get started. So we do want to hear from you, but there is one, we do want to hear from everybody. So before we get started, a friendly reminder, how long do you have to comment? 2 minutes. All right, great. All right, next slide, please. All right. Before we jump into the questions, let's see. Before we jump into the questions, there is one kind of comment that I do want to make before we get started on that, is the Maryland Department of Health is aware that all of us are very concerned about the impact of HR 1, which you all may know is the BBB, or the Big Beautiful Bill, and how that impacts you all, and wanted you all to know that they are working on an FAQ, a frequently asked questions document, that will be shared once the state has completed its full analysis with that. So just really want to put that out there first and foremost. All right. So without further ado, next slide, please. Our first question. All right. What 3 things should DDA focus on for the next 6 months and 12 months? Right. Thank you.
Hi, thank you. I really think it's going to be very important that DDA focuses on communication and collaboration with participants and families. And I know that's a goal that they've been working hard to try to make happen. However, with the new waiver changes that have occurred, there was a lot of public comment that was given, and very little of that public comment was taken. And there is just a litany of just disastrous things that are going to be extremely difficult for participants. And I just have a lot of concern as to how the FMCSs are going to manage everything in self-direction and how DDA and the CCSs are going to be able to manage everything. And I really feel as though the cart has been put before the horse, and we need to slow down and take public comment and really work together to make this waiver workable for everyone involved. Thank you.
Thank you. Yes, I'm so sorry. Can you really quickly do you mind introducing yourself? Thank you.
Absolutely. My name is Karen Smith, and I am a parent of a young woman who's been self-direction since she was 8 years old. So it's been about 18 years now. And I've kind of seen self-direction go from when parents actually wrote the ACP and wrote the budget to where we are now. And some of the things are just extremely devastating, especially the day-to-day admin that's been taken for 40 hours a week to 10 hours per month.
Thank you so much. Yes, comment right here.
It's James Kujo from my parents. I didn't think that I wanted to launch straight into there's a comment about questions, but I didn't know the format for this. I brought the presentation on whatever is happening, then comment on that. Be that as it may, in terms of this statement, I'm new to self-record, and I'm not even in yet, right? But we've had 20 years experience in DDA support for my son, who I wish was here. The general observation is that getting into SBS is too complicated. Your processes and rules and so forth is overly complicated, right? I have been around investing in my professional life in several benefit programs, federal level. I'm a consultant by training, all right? Supported several federal agencies that have benefit programs, which serves millions of dollars. This is the most complicated benefit application that I have run into from my consulting life to help me. I mean, it's stressing. We're trying to get in. 9 months, in this effort, we are now heading to a hearing, right? Heading to a hearing, and you say, for what? When my son has been in DDA for 20 years, right? On the other side, and we were forced, all right? We were forced to try SDS. I did not know anything about SDS 9 months ago, right? So it's overly complicated trying to get in. Application, vet it, make a decision, 9 months, and we get a denial. And we say, for what? If I had my son's case presented in this room here, right, people would scream. That what is the justification for this complicated stuff and all the expense of the 9 months, not to speak about the emotional toll, right? All right, and my son is not being served as intended by DDA's mission.
Thank you. So I'm hearing that they should be focusing on is how to make things less complicated. So thank you.
That's it. In the next 6 and 12 months, it should be a priority.
Thank you. All right. Someone else? Yes, please.
Good afternoon, everyone. My name is Keith Haynes. I'm here. And in terms of what we should focus on, I'd like to reinforce what the gentleman just said. We have our process is once we're all in a process that's extremely complicated and difficult. For our case, specifically, we applied for our daughter's cerebral palsy compliance with wheelchair. We applied over a year ago. The online interview was had everything approved with that interview. Submitted the paperwork to the DDA office in Laurel. Received our saying it was denied. We sent a tremendous amount of paperwork to a supervisor at the time. I don't remember her name. The thing is, you have to remember anything, it's been over a year. So the enrollment process, I believe, should be simplified so that if you need to talk to someone, the receptionist who answers the phone doesn't appear to have a lot of information. So if you look at how the program is set up to enroll individuals, this get us started and it worked out with benefits may be eligible for later on, but we can look in first so the start process is done.
Thank you. All right, our overflow room, do we have folks that have comments? Okay. All right, let me, okay. How about if I move to virtual? We're just in 3 rooms here. Thank you for your patience.
Our first question is going to come from Doreen Tremper.
All right, well, why don't are there other comments while we're figuring out yes, thank you.
Hi, I'm Denise Stone, this is my son, Robert Stone. And Rob and I both advocate at the federal and state levels with multiple organizations for children and adults who are medically complex and or have diseases. And we are both concerned that people who had a licensed nursing background, and that's what I mean in this context, complex, face extraordinary hurdles to putting their services together. And so I think it would be great if the DDA would focus on this issue, which in our community basically you can't put things together, and your child is like on a fast train to care facility. So, and I discussed this in our plans. This is going to take the DDA, take other parts of MPH, from the benefit of the vision of this program. And frankly, even the Office of the Attorney General needs to be involved. This year already, so involved. So we just want to throw that out there. That's really significant for this population, and also just for anybody out here that have their cards. And you can also purchase them, you can get their contact information.
Thank you. I saw another hand there. Yeah. And then we'll try virtual again, Dr. Smalls. Thank you.
Hi, Karen Lee from C, and I wish we could think about 6 months from now, but in 3 days from now, there's a lot of people we provide supports to that their jobs are going away because they work for the federal government. When I was trying to admit to one of these shutdowns, we needed to flip services really quickly for people because their job currently provides them with the structure, the daily support that they need. And we needed to flip them very quickly back into the like some sort of CDS or some sort of community learning engagement at the time. And so I just would like to ask that DDA have a fast track way of supporting people who currently work for the federal government and may be placed on leave starting on Wednesday or Thursday, I guess, to give them the additional support that they may need. And there's an infrastructure way that we can have communication so that we can put people into more intensive supports during the shutdown.
Thank you. All right, I see your hand. Let me try virtual, okay? Let's try virtual again if someone has a comment. Thank you. You should be unmuted to be able to share your comment. Thank you. So thank you, because I was kind of surprised that the virtual audience was being extremely quiet. So that's what it is. So it sounds muffly. Okay. All right. Okay. We'll see what we can. Is this sound any better to folks that are on virtual? Maybe it was me not standing close enough, or they weren't able to hear the audience's comments.
Hi there, this is the sign language interpreter Nathaniel. We can hear the panelist or the person who's hosting the meeting just fine. We cannot hear the audience very well. It's very muffled.
Okay, all right, thank you. I appreciate that. All right, let's try one more comment from the virtual audience, and then I promise I'll get to you. I really want to give our virtual folks a chance.
All right, can you guys hear me okay?
Yes, thank you. Please go ahead.
All right, cool. So in regards, first off, my name is Jake Dudinsky. To start with that, I have autism and a mitochondrial disease, just to give you guys a bit of a baseline on where I'm coming from. In regards to the question, which I believe you guys are asking, which is where you guys should be trying to go or what you can aim to do in the next 6 months to, I think, a year, what I personally would really like to see DDA focus on is some of the stuff that you've already heard. I would like to see a more simplified, streamlined communication with a focus on, education within ableism. I feel like our state has a really big problem with people not understanding the concept of ableism and institutionalized ableism. Sorry, I'm hearing a weird music coming through.
Yes, I am too. I apologize. Hopefully we can get the other person muted. All right, try again.
No worries. So I would really like to see that be a focus. Secondarily, I'd like to see a boosted training on complex needs, specifically those who have more than one thing that we would classify under DDA, right? Like someone like myself who is autistic, has a mitochondrial disease, is in the hospital for various different reasons at different times, requires a lot of very uniquely different complex care, and I don't fit in the one bucket, and there are more like me. And then I also think you guys should focus more on the concept of flexible and self-directed care. All that goes with saying, I think, with the reality that focusing 6 and 12 months down the line doesn't do us a lot of good if we don't get 6 or 12 months down the line. I think sometimes we talk in this scheme of bigger pictures without realizing that some of the things that are happening right now for people in my community, like, it's life or death tomorrow. It's not, we have 6 or 12 months to figure this out. It's, if I lose my Medicaid tomorrow because somebody decides I'm no longer disabled for some reason, then I will be dead within a week. And that's, I think, the harsh reality that I don't think we ever talk about. So I think it just needs to be more of a realization that talking about things is great, but putting stuff into action is way more important. Thanks for taking the time to hear me.
Of course. Thank you for sharing. All right. You've been so patient. One last comment on this question, and then we'll move to the next question. Hold on one second. Oh, I'm so sorry. Yes, you did. Okay, you started. Go ahead, please.
My name is Vicky. I just want to say that DDA does a great job when providers get a new residential place. They come over quickly and do the inspection. OHCQ comes over, does the inspection. But then it's like way of management. Then it's the prep number. That's MA number. It's like you just have no clue. You can't make any business decisions based on anything when to get the MA number. Is there something? I feel that DDA should focus on reducing
but providers have to wait to get the MA number. Thank you.
Thank you. All right, for those of you that are virtual, I know we had some technology, so please make sure you type your comments in the chat because we are collecting them. So if we could move on to the next question, please. Oh, I'm so sorry. All right. Okay, so I tell you, all right, let's move to the next question. I want to try to get through all of them, and then if we have some time left, we can circle back. So please hold that comment, okay? All right, next question, please. So tell us, DDA would like you to tell them what is the best way to communicate with you about important changes. Comment. No, you're okay.
I think something that could really be helpful is clear, concise communications through the CCSs, through the super brokers, and in writing in small doses, because receiving a 600-page waiver and a 200-page manual to try to digest. I know I'm also a support broker, and all of my clients are reaching out to me saying, I can't do this. I don't have the time. Can you please tell me how this is going to affect my child, my participant? Like, please help me. Everyone's just crying out for just smaller doses or ways that they can receive the information in a more manageable way and a little more time to process it all.
Yes, it is. Yes. Thank you.
Thank you. My comment actually dovetails on yours, and thank you for hosting this meeting. We really do appreciate the opportunity.
You are so welcome. Can you introduce yourself?
Yes, I'm Stacy Heller, a parent of a 27-year-old daughter who has been self-directed for now, since the beginning of the pandemic. So, just in sort of following up on this last comment, I feel like I know more than our CCS does at this point. The CCS, what I've been asking about, we're also in the process of submitting our annual PCP. So all of this is happening. PCP is due, our next plan year is October 15th. These changes go into effect October 6th. So we've been in this sort of fluctuation, transition of not knowing if all of the waiver changes were going to be effectuated. We now know that they are. But having to write a plan that straddles the services that we have and those that we think are going to be good. Our CCS has summarized changes of, well, they're just really consolidating waivers. So there's a lot more. I mean, that's obviously a big change. But there are so many more changes than that. So I have no idea how many trainings CCS have had on the waivers. So I've been trying to attend every webinar. I've submitted questions that have not gone answered in any of the forums. Didn't make the FAQ, were just passed over. So I still have tons of questions. I don't know what the form is to get them answered, and this doesn't sound like it's the one. So thank you for hosting this. I hope there's an opportunity to actually have the issues and questions addressed.
Right. No, thank you. So yes, this is comments, but I will, because that was one of the questions I asked, right? All right, so everybody's going to come and share their comments. Then what, right? And so all comments are being collected, right? And they are all going to be reviewed. They are all going to be posted, right? So that everybody can see it, really trying to make sure that we have, DDA has transparency with all of this. And then really looking at this also going over and being shared in public areas, as well as with the Waiver Advisory Committee, and really taking into consideration as they are looking at doing the informing the design piece with this. And that's right now, that's where we're at, is in the collection piece. But it's really important to hear when we ask a question like this, right? What's the best way to get this information? Everybody wants to So thank you. I saw right over here because thank you.
Also in South Africa. And I feel that the communication between the participants and the police is very important. I think that a lot of the changes that have been, I know we hadn't heard of them, we just started hearing of them about a week ago with a new potential support program. But I think the consistency was there with the CCS that everything could be related and understood more than what it is, because we're on like fifth CCS of the year, maybe six. So we don't even, they never get to know her. And then when we get one good, they're gone. They're there for 2 or 3 months and they're gone. So I think they can start with consistency with the CCSs and the families, you know, because it's inconsistent. It's a revolving door. As soon as you get adjusted to something, it's a change. And it's that. That's all.
No, thank you very much.
Hi, my name is Carol Hoyes. I think communication is really important, and adding on to the comments, our PCP was supposed to be approved in February. It's been on to extend. And it's like nobody actually tells us when it's officially approved. Is it the CCS? Is it the support broker? We're actually having a meeting tomorrow about our new PCP for next year, but we don't have an official confirmation that the one for this current year is even approved. So I don't know who is supposed to tell us, but surely if DDA approved it, could we not get an official email from them saying your PCP is now approved? Because it goes to the FMS and then it disappears for months. I mean, it's been probably 3 months with the FMS, and we don't really know what we're dealing with for the rest of the year. So I think the communication on the big items they send out, like somebody said, these long emails with manuals and 600 pages, but what about the smaller details that we're not actually being informed officially about? So we don't know.
Oh, sorry. Thank you. All right. I'm a mover. All right. So right here. Oh, okay. All right.
Hi, my name is Michelle Cameo. My daughter, Madison, has been in the first 2 weeks. Participants went back to directions and, of course, in terms of celebration. The first, I just want to thank you for having a space for us to get together and have this conversation. But one of the ideas for me is what I would expect is this is exactly what my thought would be prior to things changing today, amendments changing or the waiver changing. So it's kind of a little too late to have this meeting today when we should have had this conversation happening months ago in person. And I will say that things have, as far as communication, and really working on this communication, so I do appreciate to the department, so thank you for that. But it's a process, and at one point, we had a 6-month window of time where when there's proposed changes, we had 6 months for public input. And we're really dwindling each time when there's a change. So, but as far as to get back to the original question as how to communicate changes, recommending that we do these in smaller doses. So again, going back to how we used to do things where we relied on the regional offices and regional offices, that would be a great way for them to get to know the participants that they're serving and the families of the teams. So we break out into those areas and utilize those regional offices and having these having these conversations. But the 6-month process, it starts at the top. So then the regional offices get trained, and then from after the regional offices get trained, then the CCSs get trained. And after the CCSs get trained and they know it, then support workers and the other professionals on the team.
Thank you.
Thank you.
Thank you. All right, right here, and then I know we had one over here. Yes.
Hello, my name is Shaggy Thomas. I represent Lewison. Pretty much my comment was since so before I was at Lewis, I actually worked for the Southern Borough Regional Office. And so kind of have an opinion on both sides. But my comment in terms of how DDA can better communicate with stakeholders in general, I remember when I worked for the Southern Borough Regional Office, I was on a team called Provider Relations. I'm not sure how relations changed. But when I was on Provider Relations, we had a caseload of providers that we had in our particular region. And one of our responsibilities was going in person and meeting with those providers and answering any questions and providing that technical support. And I think we've gotten away from that. And I think we need to go back to that. I think a lot of times, because providers, and not to take away from any sort of self-directed services, but particularly with providers, what we struggle with is that we're dealing with multiple entities, right? We're dealing with ED and that whole show, right? And then we have DDA. And so I think it would be more helpful, and it would reduce a lot of chaos if we go back to the basics, because it was not broken, so it did not need to be fixed. And so, yeah, I really think that DDA may need to revisit caseload assignments so that we can get more in-person technical support.
Thank you. Thank you.
I want to say that I do really like the Connections newsletter that you are putting out. Continue that, and to just make it more robust and put more into it. One topic that I think needs some communication around is state-only funded folks. There's a lot of people that are still getting services, but we know that we don't know what's happening next year. So it would be great to have more information in the newsletter. We helpful to have maybe some information sessions specifically on that topic, or affected by that, so that we can know what to do and how to advise people what they need to do to prepare for whatever's coming next for their services.
Thank you. All right, I want to go to the overflow room and see if anyone has any comments. And then we'll go virtual. All right, our overflow room seems to be quiet. All right, let's try virtual.
We have Mariana Corona, and I apologize if I pronounced your name incorrectly.
Please share.
Hello.
Yes.
Can you hear me?
Yes.
Yeah, I'm a parent of a participant. The frustration we are having is with the CCS when it comes to budgeting and how the budget is being sent to the FMS and the payments, we don't get the current payment, and the vendors will be having problem in sending their invoices. The second question, they keep changing CCS. We, the family member, are always in a bind. You ask the CCS, they don't know much, they will get back to you, and it creates a lot of frustration. And the third question I have is with fellow. Whenever we have problem with payment, there's no one to talk to. We keep sending tickets over and over and over. So if DDA can help us with this, it will be appreciated. Thank you.
Thank you. Do we have someone else on virtual that would like to make a comment?
We have Corey Shannon.
Hi there. Hi there. Hi. So I'm a support broker, and my brother has been in SBS for, I don't know, a decade, for a very long time. The biggest communication problem that I encounter is when DDA has revised or clarified something or added a new policy or rule, we're not informed by DDA. I find out that documents have changed for health insurance, that things that will be paid by health insurance. I only find that out when it's denied. I'm not sent an email on the participant side or on the support broker side. And sometimes months later, it's brought up at a webinar. Oftentimes it's never brought up. It is a problem that the best source of information that I have as a support broker are the other people in the community, you know, with online groups and whatnot. It should not be that way. It feels often like things are put into a newsletter at the end of, at the end of an email, really, really important updates. And technically, yes, they are eventually communicated. But most of my clients, especially the caregivers, are older parents, elderly parents, and they don't use email. And they, and I know it's easy with our jobs. We kind of assume that other people use email too. But might I suggest that maybe a pre-recorded message that is auto-dialed to people's phones, perhaps a text message system that you can opt into, just anything other than what we have now, because it is very, very difficult to help my participants and my own family with the lack of communication that we have right now. Thank you.
Thank you. Let's take, since online virtual is working, we were a little rough to get started. Let's take one more from virtual before we move on to the next question. That is, if we have another one. Well, I see you. I see you. Hold on one second. I just want to make sure everyone has an equal opportunity. So,
Jennifer Martin Johnson.
Thank you. Jennifer? All right, Jennifer seems to be having a little bit of trouble. So, all right, I will take one more on the question around best to communicate, and then we'll move on, okay? Thank you.
I'm going to say, we let's see, and during that time, I don't know what happened, but he lost his waiver. He's had it since he was 21 years old. He's not 39 years old. Meantime, things happened, and I took him away from seat. And I miss mom and taking care of him. So Mars is trying to get the waiver back so that I can take care of him, get care of him. Because he's gotten 3 times the size that he was when he lived in the seat.
Mm-hmm.
Anyway, and I need help. So they get touched, and this has been going on since February. We've been trying. The state started to get it, and now I've been trying. Mars has been trying. We haven't heard anything back. It's been reviewed, but still nothing. And he's somebody that should have his waiver. Why did he use it in the first place? I wonder why he doesn't have it. There should be no question.
Right.
Thank you.
Thank you for sharing. All right, let's move to the next question, please. All right. With the proposal of one waiver, will services be equal for families based on need? How is eligibility determined? So this one's a big one, okay? With the proposal of one waiver, please tell us what you don't understand regarding the eligibility for services. Let's take that one first, and then we'll move into the next one after that, because these are very heavy-duty questions or questions for your comments, I should say. Give you all also a moment to read them. Yeah, sure. With the proposal of one waiver, will services be equal for families based on needs? How is eligibility determined? With the proposal of one waiver, please tell us what you don't understand regarding eligibility for services. So give you a moment, and I saw a hand back there.
Hi, it's amazing. As I said earlier, the eligibility determination is extremely complicated. And just listening to some of our comments so far, it sounds as if there are bottlenecks in different parts of the system for services to be approved, to be recognized. 6 months to a year seems excessive from everyone, for most people here who have vulnerable children with disability. A time frame of 6 months puts a tremendous strain on everyone. So, in terms of how to simplify the process for one waiver, I think again, the simplification or oversimplification should be part of the process to get people on board to make that determination.
And to help their understanding.
Oh, absolutely, yes.
Thank you. Other comment? Oh, yes, over here. You're getting your steps in.
Thank you. Steve Keener from Jubilee again. Something that I don't understand is your policy related to one-to-one service to people with diabetes. And that's one of the things that you wait for one.
Me too. Right here.
My comment is, once we go to one waiver, we're moving from family waiver, and then we have family waiver, that's a new child. Now that we're going to the other waiver, that's still the requirement that we just do it.
Good question. Yes, thank you. Oh, and then I see the back row. How about, can we go to the back row and then work our way up? Is that okay with you? Okay, thanks.
That comment about parts of services. For example, family support services, there was just personal support. There were no community development services or residential planning. With everything being under one umbrella, how is that going to affect everyone under all ages, from infants all the way up to the
Thank you.
I know how some of those I think I'm hearing consistently it's a process. And I think what happened is, and I'm close to it, is that we create systems and we understand it, but there's an assumption because we understand that other things do.
but I think our question that
Mhm.
there's an assumption that with waivers, people understood all three.
Mhm.
If we didn't understand all three, if that's not enough. I think the key point on the communication side is to simplify it, break it down to pieces that people could understand it,
Mhm.
have it available in different formats for people to receive it. Change is consistent. We have to sometimes work on crisis management. Where do these changes come from? If it's state, federal, tell us that. If it's DDA trying to fix the system, tell us that, and then break it down into the simplest format, so that everybody can truly have somewhere to go, find the steps, and that we're all consistent in how we implement those processes.
Almost like a flow chart, right? If this, then this. If this, then this. Absolutely. I'm going to try the overflow room and see if there's anyone in the overflow room that has a comment. No? Okay, they're just going to be quiet. All right. Other comments in here before I go to virtual? Okay, great. Thank you.
Hello, can everyone hear me?
We can.
Okay, I'm sorry, it's hard to hear folks who are there in the room, so if this is a repeat, I'm sorry. You asked about what part of service delivery what part of eligibility do we not understand? Is that right?
Yes, it is.
This has to do with personal support services and supported living services. I understand the DDA may, for up to 6 months, approve enhanced levels of both of these services until a behavior support plan or nursing care plan is in place. Can you explain what the standard level of personal support services looks like and the standard level of supported living services looks like for people without nursing care or behavior support plans?
So that, okay, thank you. That'll help folks to understand then, understanding what about eligibility. So thank you.
Right, I think, sorry.
Go ahead, I'm sorry.
And so we all understand what the criteria for eligibility of either a higher ratio, 2-to-1, or a enhanced support. But what does the regular support now look like? For personal supports, is it still 1-to-1? For supported living, what does that one look like?
All right, thank you. All right, other comments online? Okay, he seemed, we'll move on. Other comments before we move on to the second part of this question? All right, so if we could go back to the second part. Oh, did they unmute? Okay, great, thank you. Beverly.
Hello?
There, yes, we hear you. Beverly?
Yes, I'm sorry. I didn't get the signal, so I apologize for the delay.
That's okay.
I wish DDA, the CCS, and the CCS coordinating agency would treat the family members and the constituent with a little more respect, especially when you try to inquire about the new requirements and also what's the proper procedures about supporting your sibling in the system. And thank you.
Thank you. All right. Other comments? All right. Can we go back to B under question 3? Thank you. So while Dr. Smalls is getting this back there, this is the second part of that question. DDA has communicated these changes through various means and formats. How else can DDA best communicate these changes? Yes. Thank you.
Hi, I'm Amy Swada. I am a sport broker and a sport broker since 2020. I work with a team who our main focus is for instance, from underground communities and immigrant communities. There are, I think, multiple parts to this. I personally myself have a degree in political science. I was reading through and when I have a policy background with policy understanding, having written policy amendments and proposals before myself was going through and reading, and it was very dense. It was not, for me, someone who again has looked at these things multiple times before, easily understandable. I think that the core principles and the core values of self-directed services are stemming from disability rights and civil rights. So for participants, when when it's difficult enough for their parents to understand, then how are we going to help the participants themselves understand and really truly get to what it means to be in self-directed services? The other part is about language access. It's something that my team and I have brought up many times before. Unfortunately, not receiving the clear answer. I think effort, making sure that this information is shared in multiple languages as well as formats. Yes, there are videos, there are interpreters here, but a majority of our customers speak Spanish. They're not here because they don't know what's happening, and there's 23 of us. We can't possibly get to everyone. There are other support workers who speak other languages, but there's not very many. Consulting with other governmental divisions like the Department of Labor, making sure that everything is in accordance with the information. I can't remember the name of it. Their Information Act, whatever it is. Making sure everyone has the same information and making sure that everyone has the opportunity to see these things, to participate in public comments. Those are the things that are really, truly important, not just for us, but for us as support brokers to be able to do our jobs.
Thank you. Thank you. Other comments? Yes, right here.
So, just going back, I had to take a picture because I didn't remember the full question as far as, so DDA has communicated these changes through various means and formats. And yes, I agree, we've had webinars. The problem with the webinars is that they only have time to answer certain questions. And but I know for me, none of my questions were answered. They were a little bit more detailed. But most of the questions that were answered in these webinars were very generic and more just top level versus specific questions that, and with self-direction, each individual is unique, so it's going to apply slightly different to each team. And to echo what the young lady just said, it's very dense. That over 600 pages when we initially were communicated that it was going to be just 3 waivers combining into one. That was not the case. And so to come through 600 pages is extremely, it's exhausting for the average person. That is a lot. And time to really learn every single change and effectively apply it is challenging. So my suggestion would be to have meetings like this and allow everyone to ask their questions, have their questions answered. My concern with not answering the questions is that because they're not sure. And that's how I take that, is they're not sure.
Thank you. Other comments? Yes, in the back there. I see you. Did you just have your hand up? Oh, okay, I'll get you next. Right behind you.
I'm the parent that my child's been in services for 10 years. I'm a sport worker. On the issue of how we, I think we're going to be in the manual, an excellent concept, and it allows us to spend time with our right now. That whole stretch. There were some pieces that were excellent before that didn't make it. One is to be able to do a lot to be able to fusion who does what routine. Is a grid that was first put out on July 1st, 2023. It showed all the responsibilities of the team for things like submitting budgeting, and then a column for the CCS, a column for the sport group, and a column for the day-to-day administrator. It laid out in each box in the grid whether the person could do it, or what circumstances they could, or when they must. And there's so much change in that. And even though I do study, every read every line is some pages, every policy. I really, as a support worker, I don't know what it is that I'm allowed to do, or what I'm supposed to do. For example, questions earlier about who knows about approval, who communicates with approval. On equity, clearly shows coordinating and submitting the BC. All the boxes are gray except the CCS. CCS is the only person that coordinates and submits the plan, period. I'd like, if you could, someday have a row on that, but let's see if you could take it back in the video. Maybe so you put a line in here that says access to LTSS, which is a computer system where all these things are actually reflected. So as we have access to CCS, and only CCS has access to LTSS. Now, FMCS does, DDA headquarters does, but nobody else does. This was done through the law passed a few years ago that said that we were supposed to try to get there. What we're doing. To answer your question about the plan of approval, so we got to know the only person who can know that on the team is CCS.
Thank you. Yes. How about right behind you? Oh, I'm so sorry. Hold on a second. I promised him next. So sorry. I just saw all the hands go up. Sorry.
So I'm going to this question as
Mm-hmm. Yes.
And one of them very useful is to have rules and responsibilities for communication, especially official communication from DDA.
Mm-hmm.
I'm very, very confused about where we expect communication decisions, right? I'm learning the SDS application of the DDA, okay, because it's all language and sovereign agreements. Right now, I'm a case where DDA has made a decision,
Mm-hmm.
and I found that out in the CCS, okay, with a letter that was addressed to my son with his mailing address, for instance.
Mm-hmm.
CCS found that I pulled it out of LGSS for what I understand and sent it to me. This is a decision from my son with his
Right.
We did not get any, I actually remember anything that I was DDA. That I was waiting and waiting, and didn't go out to that recommendation record for my son.
Okay.
Not right. So helpful to have those responsibilities that for DDA decisions, DDA will talk to you or whoever. CCS can provide this and that information. If that was available, right? going to what they expect from, source.
All right. Thank you. All right, in the back here, and then we'll go to the overflow room next. Go ahead. Mm.
So I would say, leave it fun, maybe a simple flyer, send them a letter in the mail, put them back to the center.
And short videos, very short videos. Yeah. Let me go to the, I see your hand in the back. Let me try the overflow room again. See if we have anybody. No? Okay. All right. Let's try virtual. And I do see, don't let me forget her. Okay. Can we try virtual, please?
Hi, can you hear me?
Yes. You can introduce yourself.
Hi, this is Adult Protective Services in Wycomico County, Maryland. We're over on the Eastern Shore, and we would like to ask something that kind of goes hand in hand with the first question, along with this last prompt about eligibility. We strongly believe that there needs to be a focus on expediting the waiver process in emergent situations. We've had multiple cases where vulnerable individuals who have severe medical neglect, homelessness, and other life-threatening conditions are pending on the waiver for months. Both regional and individual CCSs are aware, and the CCSs do tend to try to be communicative and try their best to get us answers, but they are at the mercy of others. These situations are labeled critical on lists for DDA to review. However, they remain pending, and this time lapse is putting individuals in life-threatening situations as they have no ability to self-protect nor permanent options. We just would really like it known that in order to provide safe stability placements in partnership with the waiver, the turnaround time, has gone from us being told 60 days to 90 days and now months at some point. And we have people who could potentially die while waiting for this waiver to kick in when we are sure that they are eligible for it.
Thank you. Anyone else online?
Hi, can you hear me?
Yes, if you could just introduce yourself.
Sure, my name is Rosemary DiPietro. I'm a program manager for the Coordination of Community Services program in Montgomery County. This question of how else can DDA best communicate changes, what I'd like to add is that it would be helpful if DDA would collaborate with CCSs, providers, and families when they're developing final products in advance of issuing those final products. For instance, engaging CCSs as the forms and the manuals and the policy stat and the various guidance that are being developed are in the hands of the people at DDA who are building those new forms and manuals that we as CCSs are responsible for knowing and being able to apply, and participants and providers being responsible for knowing how to use and apply. We would think that if we were involved in the development of these tools and guidance that enable people to get their services and to get these changes implemented into their plans, it would smooth things along tremendously across the state. It's not just a Montgomery County issue. I can assure you that other CCS agencies would love the opportunity to collaborate, really collaborate in the development of the plans and the processes and the forms that we are by law required to implement and complete. And there I would finally say that adult learners require hearing information 7 times before they can apply it.
Thank you so much. Any other comments online?
My name is Sarah Switolski. I'm with Adult Protective Services in Wycomico County. I wanted to address an additional thing that I just think that DDA could potentially look at focusing on. This one is a bit big. It's a bit of a change in eligibility and looking at that, but I genuinely believe there's a large gap in the individuals aged between 18 to 21. I understand that school is supposed to kind of cover these individuals, but often their legal guardians or parents are pulling them out of school. And then we have DSS coming in and being involved, and we can't get them into placement day programs or get them any kind of assistance when they are in these situations of severe neglect, medical neglect, abuse, at risk for homelessness, and there's just not really an answer or any help or assistance. And again, I know DDA starts kind of helping at that age of 21, but looking at maybe some alternative funding options or looking where we can partner and make a plan for these individuals, because there is a huge gap. And eventually they do come under those DDA services. And instead of playing catch up, maybe we could headway and get them when they turn 18.
Thank you. Appreciate it. So in the, let's see. Yes, right, the gray shirt and then the kind of lavender-ish. Periwinkle, there you go.
First of all, thank you for doing this. I love this in person. That's great. Just 2 things in terms of communication. I want to second the comment that was made about process chart. I think that would be really helpful to everybody who's connected to these supports. One for initial eligibility and one for redeterminations in terms of eligibility process. And then the second suggestion I have is, and this has been kind of a long time issue, is consistency between all the different source documents. So you have the waiver, policy staff, billing guidance, and regs, accounting statute. And that has been difficult because the inconsistency leads to confusion, and people look at one thing and then DDA points to something else, and OECQ points, surveys on something else, and it makes it really difficult to be in compliance. So those are kind of just 2 simple suggestions.
Thank you. Appreciate it. Yes, right here. Yes.
I have Gina and Scott studying. And in fact, this is, I'm sorry, didn't catch your name. But in all of these forums and discussions that we've had, and kinds of opportunities that Rob and I have had at the federal level for advocacy, I'm concerned that the DD population, both participants themselves and families, simply don't have an understanding of what a context for their own civil rights. And I think that it's important that people have that context, because a lot of people don't know that people with disabilities are not included in the Civil Rights Act. And 64, 65 years. That it depends on 3 separate things. The Americans with Disabilities Act of 1990, the 1999 U.S. Supreme Court decision on Olmsted versus Los Curtis, and then the recently revised and updated Federal Organization and Certified Services. And so, on the one hand, Medicaid is an incredibly complicated insurance program that's administered to all kinds of people other than people in addition to disabilities. And the waiver has a specific role in ensuring that it strengthens basic civil rights. And that phrase, that you have the right to receive
254 and Title 2. Writing senior services in the most significant setting according to your needs is what's relevant for your civil rights. And then needs is unrestricted. It's not just your medical needs, it's not just your social needs, look at the whole person.
Right.
Anyway, my time's up. So that's sorry.
No, thank you. I really appreciate that. All right. Yes, thank you.
Thank you. Again, my name is Karen Smith, and I have two suggestions related to self-correction specifically. DDA has implemented a lot of wonderful things with support workers having to take a specific test and everything. However, the FNCS are an integral part of making self-direction work and allowing employees to get paid on time and vendors to get paid and just everything. And to my knowledge, there's no testing procedure for the FNCS to make sure that they fully understand what the changes are. There's 3 FNCS in the state of Maryland, and I work with all 3 of them. And every time I call, even within their own agencies, the employees that work there give me a different answer, and some of their answers are just so off the chart, like not reasonable, and I have to point out to them in the manual where this states this. So I don't know if this would be possible, but I think it would be really great to get a work group or a meeting with the FMCS's leadership from every CCS group, some parents in there as well, and participants that are involved in this, and roll out these changes in a very systematic time manner so that everyone that's at the leadership can understand it first, because they're trying to pass it down to everyone else, and everything's being lost in translation. And I don't think it's the fault of anyone. I think it's just maybe the fact that it's being rushed, and that if we slow down a little bit and really make sure people are trained well for all areas, and to get everybody in the same room together, because when they each learn it separately, they each understand it separately, and if there's not that communication and conversation, no one knows who the other person is listening. Thank you.
I appreciate that. All right. Other comments?
Really, just Chip Woods, St. Peter's. I just really wanted to thank Deputy Secretary Hutchinson for taking some time, the old-fashioned way of visiting our agency, coming to a couple of our events. I imagine your schedule's super busy, but it meant a lot to our families. It meant a lot to our individuals, people that we serve every day. And Robert, we also appreciate you stopped by as well, in a partnership that we have with the University of Maryland. And it was really encouraging, because a lot of times the emails, they meet the letter of the law, but really what it comes down to is relationships. And that meant a lot. And also, in terms of communication, Max does a great job with Laura, but getting to know the legislators as well and the challenges. And I know that that's been done. However, we're in the 40th district, and we make it a point to not only for the state, but also we're in the 9th ward for the city, to really get to know our elected officials as well, because, excuse me, if they don't know, then it's not going to really matter. So, thank you.
Thank you. All right. Let's go to this. Oh, we've got one right back here. Oh, and then we'll move on to the next question. So one more comment.
Yes, my name is Linda, and I think communication with the regional offices would help, because sometimes when you contact them, they tell you to reach out to your CCS, and the CCS has had no clue. But then when we contact DDA, they would use to check their emails or the phone calls. So reaching out to the parents would really be helpful, and also transparency. Transparency would be great. And we need access to LTSS.
Thank you. Thank you. All right, next question, please. All right. All right, next question for comment. Oh, you're all ready for a comment, right? All right, how about, can I read it real quick and let you go first? All right. What can DDA do to provide support and be proactive as we navigate the changes at the federal level? The lady in the very back, glasses.
Thank you. Hi, I'm Julie Sullivan. So I appreciate you asking this question with the DDA to provide support. Well, right now, this is changes by extra burden and not support. Support would have been what you were saying earlier, the board implementation. Not after families are struggling to submit paperwork before the board statement. There's no need for public comment process. Unlike the federal government, we're moving where the rules are published, the public comments, and then the agencies formally respond, and then they provide those comments in a transparent process. That did not happen. We still don't know what all the comments were from the various people in the community and whether or not we actually considered those. Second, new requirements of the name, a designated representative having forms managing our day-to-day administration, because that's been removed or reduced. Ignores the reality that self-direction is already a full-time job. This isn't support. This is another word. Third, DDA shifting more responsibility on the already overburdened CCS agencies and FMCS agencies. Our FMCS can't even pay staff or reimburse schemes in a timely manner, but now we're supposed to rely on them to make vendor payments to access individual it's not going to happen if you want to leave participants without those services. And honestly, the comments made by DDA head in the media justifying the restriction under preventing fraud and abuse. There's a lot like the cost-cutting rhetoric we hear in the current administration in Washington, where our governor claims that he opposes. The expanding successes of changing women's services, increasing a heavier burden on families. I'm running these burdens ignore the fact that DDA is supposed to be helping develop and disable people. Why are we having to jump through extra hoops? If you truly want to be proactive and supportive, you need to create a transparent rulemaking and comment process, ease the requirement of an unpaid designated representative, and fix the current FMCS issues before giving them more responsibility, so that way they can actually help them.
Other comments in the room? Yes.
Is it me?
Hold on 1 second.
Okay.
Thank you.
This is me, second, making sure that, you know, the I do think, you know, communications and keeping CCS consistently in the loop is another huge thing that would be super helpful. I know that a lot of people said that as well, and shared that. CCS is, when they're not allowed to do webinars, and then they also are not getting a formal training until October 6th, when the implementation date is. We can rely on them to, you know, for us to ask questions too. When I have had meetings this past month, I'm the one, you know, who
is expected to bring all of the information, but then there are also times when the MCSs in these transition periods, from their words, are implementing new things from guidance from DDA that no one has ever heard of. So then, again, if someone asks for my help for guidance eligible to, claim this benefit or something like that, and then we are going based off of, again, what the waiver was saying, what the handbooks are saying, what every policy is saying, but then we submit it to the FCS, they say no because they just received new guidance from DDA. It makes it, and this is just from the further point of view as well, it makes it impossible for us to work on. We can't keep up if we're out of the loop. We can't keep up if no one's telling us what's going on.
Thank you. All right. Let me go to virtual while you guys are thinking for other comments. So virtually, we had someone that came off mute?
Joanna Weaver.
Yes.
Thank you. Go ahead.
Hi, I'm Joanna Weaver. One of the comments I had was, I think all the way around the best thing to do is to think we get too focused on the paperwork of everything. And I understand why that has to be, so we can follow the numbers easier, make sure everything's done correctly. I get that. But for communication and for advocating, I think we just need to get back to the humanization of it all. What DDA is supposed to do is support those of us that need services in helping to live our best lives. And the bottom line is we have to advocate for that now more than ever, because we are beginning to be reduced to numbers on a piece of paper again. And we have to remind people that we are not numbers. We are not just the papers that we turn in for services. My services do keep my health and welfare, and I do get to have a little bit of fun too, thanks to the support that DDA gives, and I hope it continues. I'm not sure it will. If it doesn't, like the guy said, it won't be long until I get seriously ill or die. And that needs to be said.
Thank you for sharing. I appreciate it. Right. Other online hands?
I was unmuted, but I wasn't sure if it was me now. So.
Sure.
Yeah. So just kind of want to echo what had already previously just been said, which I agree with that wholeheartedly. Right. Like the saying for our community often is nothing about us without us. And so when the question comes up, how can DDA provide support and be more proactive? I mean, for starters, involve us more, like all of us, not just providers, not just, government agencies, but also those with lived experiences on the family member side and those with lived experiences as the patient, right? We can tell you a lot about what we've been through. I can tell you a lot about the things that I personally need, that my friends personally need. And being proactive starts with me not having to get an email 10 minutes before this starts to find out it's happening. Like that is inherently at the onset just not okay. I shouldn't have to be forwarded this 3 times to find out it's happening, because that tells me that the outreach to the, disability portion part of the community right now isn't there. And so what I would stress is that you do have people who want to go and try to fix the system with y'all. And we are very, very capable if you give us the chance. I promise you, no one's going to fight harder for our community than our community. You just have to give us a chance to do it. I don't necessarily know what that chance looks like, but what I do know is that when this turns into bureaucracy and arguing about this letter or this law or that law, my friends are dying while paperwork gets figured out. And so that's just would be kind of, I guess, my pitch is communication starts by actually wanting to communicate and figuring it out that we don't all communicate the same way. That can include things like social media, getting people to see things that are happening, mailers, as we've heard, or email. I would just simply stress that we're living in a time and in a world that requires some outside the box thinking. We've always been really good at that in this state. There's no reason to stop now.
Thank you. All right. Was there one more online and then we'll come back to the room?
Yes, hi, this is Irene Swada. First, I am thankful for the people who have presented so far, and I really want to share my admiration for APS and the CCS agencies that have spoken up, because I know this is not easy. My main thing, and piggybacking off of what Jake just said, I work with people who live on their own, no family involvement, can barely pay rent. I mean, it's very, very limited resources. And I feel like those are the folks who are not getting as much attention, who are dropping out of waiver because of documentation, because of BDD not attending to their waivers in time. And I know that DDA is not the same as eligibility, but we need to do more. We need to do so much more. And this doesn't just affect self-directions, it also affects the provider managed services as well. And this is critical. People are losing their homes, they're losing their health insurance, they're losing a lot that makes their lives stable. So as a community, we have to do more to make sure that people can keep their services. And if it's, because of bureaucratic issues, like, we need to overcome that. We have to get over it and hire more people with EDD, talk to the governor. It doesn't matter. And the thing is, when everyone is receiving waiver services and getting reimbursement, then everyone is happy. So the state gets their money, the people get their services, and those of us can lower our blood pressure. Thank you.
Thank you. All right. Comment in the back. Yes, right here.
Karen Lee from SEEK. I think when we think about federal policy, we think about what's happening down on Capitol Hill. And there's so many more policies that are integrated. I think the last speaker just said that very same thing. And especially people who are relying on the provider community to help integrate things like HOC certificates, public transportation or paratransit, SNAP or WIC, or all the different kinds of services, Social Security. And so I think there's a domino effect that happens when there are changes at the federal level. And I know that DDA's primary focus is Medicaid and the waiver. And recognizing, I think, and learning more about how we integrate all of these different sources of support for people, including things like access to recreation supplements and all sorts of things. And so I think, and I don't exactly know how to do that, but for DDA to keep an eye on how the impact happens. So people who are getting their food supplement right now from SNAP, and SNAP all of a sudden is gone for those people, how can we, what is the shift that we have to do, or how do we work together to address that, that now absent service? And then, so any information that you get about these kinds of things, whether you're getting them through the Department of Disabilities, or you're getting them through housing, or you're getting them through transportation, to continue to remember that all of those services are not just the DDA services, impact the people that we support, and how can we work together and collaborate at the state level. I know there's some work being done at the federal level, how we work to collaborate with people on all these different services that are integrated to provide supports to everybody.
Thank you. Right here.
Good afternoon, everybody. My name is Lorinda Charity. I'm a community relations coordinator
with the MCO plan with the state, MedStar Family Choice. I think with me being in community relations and outreach, the main part that we have to start with is communication. I know a lot of people think the calls that's coming in is spam, but we're actually reaching out to confirm demographics to make sure everything is up to par, including medical appointments. It's affected me personally with this DDA changes and also with me being in the community because so many people have so many questions. But the main thing that I say we could start with from a health plan is getting everybody to check in with both parts if you have state coverage. If you receive those Social Security benefits, make sure everything is documented with doctor's appointments. So when you do have to show documentation, but just reach out to your health plan. Someone as myself with MedStar Family Choice, I help you find doctors, schedule appointments, and also arrange transportation. So just know there's a lot of help out there, but it's all about communication right now. But thank you.
Thank you. All right. Thank you for waiting. 1 second online, please. Thank you.
Since I was started the session here with the comments that the process is complicated, especially for people who are trying to get in, but even if you are in, because I've had many comments connected to the network of users from different things, and I get scared as a key what am I trying to get into? I cross off one of the serious things. Now, when you have a forum like this, you hear all kinds of comments like this. The last question is about how can DDA provide support and support and so forth. What I would say is this is a major myth, right? That if DDA is interested to fix and get this on really a solution basis, we need resources. All right, this is as big as like going to the legislature for extra money to identify what the challenges are and assemble the solution ideas, because all that you're hearing is temporary, right? If you try to what you hear so for suggestions it will be temporary. This is an elephant, and people come to it with their view of the elephant, right? Because so many people are in here, all right, with different views and perspectives. Even within an agency, somebody mentioned that the employees within the agency don't understand what they're supposed to be doing and so forth. So it's huge, right? To deal with it, you need money to attack what the issues are, the confusion and the complexities, right? To understand the underlying. If you don't understand the underlying issues, you're not going to be able to provide effective solutions. Right? So I emphasize that the complications and so forth, I'm coming at it from my professional life. Okay? I've lived this many years, both in the private sector, federal government benefit programs, where we go and we advise and we talk to all the players involved in the enterprise, right? To come up with their challenges and so forth, summarize it, and say, how do we tackle it? Because things are connected.
Right.
Problems are connected. If you fix this one, you introduce more problems on this side. So, Madam Secretary, you need money.
Thank you.
Thank you.
Thank you. I appreciate it. I appreciate it. Yes, comment in the back. Oh, yes, up there.
Thank you. DDA can improve on communication as well. DDA comes out with this manual, but it seems like the participants have to follow the rules and regulations and the manual for DDA doesn't. And it would be nice how DDA can explain to the participants and the families and the teams how they can break their own rules and regulations, but we can't. Transparency has to be nice.
Thank you. All right. Other comments online?
We have Jake Dendinski. I apologize if the pronunciation incorrect.
Go ahead, Jake.
Yeah, I wanted to get a clarification on what was previously said, which was I think the concept of trying to propose solutions versus trying to just, I guess, bring up the concept of problems we have. Is that what was said? It was kind of hard to hear.
Meaning the last person's comments?
Yes. Like prior to that, I think the concept that we were able to hear was basically, it sounded like there needs to be more solution oriented discussion here versus, here's all of our issues.
I think you're hearing both.
Okay. In that case, so I think the solution requires both, just like for the record. I think that you can't get to a solution without first reaching out to the community that is most directly impacted. I think that you can ask 70 people in a room what the solution they think is best is, and you're going to get 70 different answers, right? I think that what we really need to be doing here is figuring out from these conversations what is the number one priority that we've got to take care of, like today. What is the most houses on fire thing? We've got to put it out right now type of situation. For me, I think it starts with this concept of making everything the DDA does understandable for everybody. That is a simplified, streamlined communication system. So within the next 6 months, if you want an actual valuable solution, you launch something like a dignity and language campaign, understanding how providers can talk to people, how you can talk to your provider, a public campaign that expresses how ableism expresses itself in different forms, not always just one way. I think that's something you can do. I think simple training over the next 6 months, mandatory webinar series for DDA coordinators that talk about understanding and disabling this internal ableism that sometimes we don't even realize we're doing. And then the third thing that I think you guys could really actually just do, if we're looking for solutions, like something that we can look at in the next 6 months, is talk more about self-directed services and what that means and what that actually is for people who don't know.
Thank you, Jake. I appreciate it. Other comments? Yes. Oh, I'm sorry. Yes, you're hiding behind the podium there. Here we go, right here.
Good afternoon. My comment is probably reverse the question to Madam Secretary and the West Administration. How do you maneuver, or how do you try to navigate the budget? The Trump administration, and so what we do to communicate with the people, and so that we can fit or worse for any other purpose.
So that was part of the piece, is that they're that's okay. Is that's part of the issue, or part of the next big task, is doing that analysis of what is the impact, because the dust has not completely settled on a lot of that. And so once that analysis and the implications, that was where they were going to be talking about producing a frequently asked questions and what's the input on it. And so, yes, because we all have that question right now, what's the impact?
How soon, instead of after the fix or before, that's one of the things communication disseminate.
Yes, you are correct. Yes, you're welcome. Right. So we do have some time left. So I don't know about you all, but sometimes when I see a question thrown up for the first time and I'm like, oh, I'm not sure how to answer it, right? And then it moves on. And then I go, oh, I wish I could go back and answer that question. All right. So we do have a little bit of time. So Dr. Smalls, if you don't mind running back to the very first question and give folks a chance. That first question was, what 3 things should DDA focus on in the next 6 months and 12 months?
staff is really I think that process. I think what's happening with providers is but we are struggling heavily with getting responses from ED. When we turn to DDA for support, we're almost always met with the same kind of curriculum. And we have people who are losing eligibility, are at risk of falling out of the waiver, have fallen out of the waiver. And it's almost impossible to get a response from ED or reach out to DDA for assistance. Again, not much out there. So I think one of the things that DDA could work on is maybe partnering with EDD to create some sort of seamless process in which there's again that separate supports between departments so that we can start to figure out those kind of funding and living that stress with it as well.
Thank you. Had a comment here? Yes. Yes? No? Yes? Okay.
So I would like to go back to the first question about 3 things.
Oh, yeah. That's the question we hopped back to. Yes.
So first I would say, and we've talked about this a lot today, we've also been working on that. So effective communication with participants, families, and teams. Another one would be for DDA to allow the participants to carry out the original intent of the service and not have the service changed based on a DDA's interpretation of the service. That tends to happen often. And then my third, and I keep talking about this often because I feel that this is something that is imperative, especially in rural communities, is to have the regional offices pay more part of the team approach. And I say regional or rural, but really all regions, because once they become a bit more involved, there is that building of relationship. And that is huge, especially when families, participants, CCSs get one-liners on clarifications or responses. They do not know the individual. So it is extremely important that the regional offices play more a part of the team approach.
Thank you. Thank you. Hold on 1 second. All right. Back here. Got excited. Well, it isn't a meeting if the batteries don't go dead or you don't tell somebody they're on mute.
Yes, thank you. So, just to go back to some of the initial questions, I mean, kind of expected sorry for being so selfish, but being the resource for individuals with disabilities, what happens when you do get a stumble and are able to determine where else? All roads point back to the DDA, and if you get to that brick wall, then it's almost a helpless feeling.
Mm-hmm.
So for someone like myself who's been waiting for over a year for an answer, and where do I go? Who do I reach out to? Where do I find additional resources? Because it needs to come from the DDA, but I'm not getting the response from the DDA.
Thank you. Yes. All right. I did see your hand, but I'm going to give other folks a chance. All right. I see your hand too. I see you. Other folks' comments. All right. What I'm going to try our overflow room just one more time because there's no one in there. Oh. Oh, well, that explains why we're not hearing anything from the overflow room. Okay. All right. I just wanted to make sure that everybody feels heard with that. All right. Okay. Yes. And I saw you in the back. I saw, where was that? Yep, I saw you in the back.
Another thing that I thought about by sitting here is PCP process. I know a lot of people talk about it in terms of verification requests and all that. However, my comment, more specifically, because I do QA for the agency, is just around the fact that we just had our CSQ audit for one of them last week. And I think what happens a lot of times is the provider, we focus on the safety, right? The safety and well-being of the people that we support. And oftentimes we make decisions for the individual and the family that may target that goal. But then there's not enough clarity provided by DDA in terms of what should be put in the PCP to make those things no longer a restriction. And I think that it's important for DDA to also keep in mind that, and I'm not saying you guys don't, but obviously autism is a spectrum. We're going to have some people, and I'll just give an example. For example, one of our homes, we had someone in that home who does not know how to recognize raw versus cooked food, and they gorge food, right? And so one of the things that we did was we put all the healthy stuff in the fridge and freezer. So hey, get to it, get to it, right? Nobody's stopping you to 2 a.m. to get a snack. But in the deep freezer, right, we put all the raw stuff, and what we did was we made keys for all of the individuals to be able to access that deep freezer shipping function, right? The issue came when the reviewer said, well, the individual couldn't show me that they could use the key to unlock the fridge or the deep freezer. My rebuttal to that was, well, that's what the support staff is for. You have support staff 24/7. So I think DDA needs to take into account that there are people on the lower end of the spectrum where we still want to give them their rights, right? Mm-hmm. But at the same time, we're really being put in a bind when we're told we can't facilitate or help them with certain things. And clarity on what those things should be, maybe a list of questions that the CCS and provider should ask to make sure that if there are any rights restrictions or if there are any things that the provider is coming up with that needs to be included in the PCs. We don't always think about that.
So it's person-centered plans are not one size fits all. Yes, exactly. Okay, right here and then right there and then right. Yes, absolutely. Absolutely.
Thank you. I'm going to touch on three things that some of you talked about and some haven't. One is healthcare for employees. Policy came out just recently that kind of ripped healthcare away from a number of employees, and with no notice, and it was approved in people's PCPs in self-direction. And I really think we've got to take a much closer look because you've got employees out there that are going to be without healthcare, or what they're going to do is they're going to wait and they're going to go on the exchange, and that's going to cost more money than reimbursing for the current policy that they are on the family policy. So state really has got to look at that because it's a cost savings to the state. I'm trying to think of all of it now. Number two, I know we talked a lot about day-to-day admin, and I've heard other people speak about that. We really got to look at what was taken away, and if they're going to take away activities or things that day-to-day admins can do, and they're going to ask support workers to do them, then they've got to increase the number of hours that support workers can work per participant. Currently, it's 30 hours a month. They went from 40 hours a week to 10 hours a month for day-to-day admin. It didn't increase support worker rate. So that's got to be looked at. And then there's one more then. CDS vendors. CDS vendors, there's a lot of CDS vendors out there that have to become providers now. Many of them are small businesses in the state of Maryland and are sole proprietors, and they are going to put these sole proprietors out of business because of the restrictions and the guidelines that they're putting on the CDS vendors. Plus, participants are not going to have these activities to go to when there's such short notice that there's for those individuals to go into. Thank you.
You got all three. All right, right here and then right there.
Yeah, thank you so much for the final opportunity outside the room that why can I ask?
Yep.
And it has to do with the term that the term is person-centered.
Mm-hmm.
Person-centered. I love that term too much. So I'll take a look at it. This term needs to be defined, included in the definitions as well. That can happen.
Mm-hmm.
To be defined, and that should be the central focus. Okay. All the people represented here, if it wasn't for the individuals with disabilities, we will not be here. We will not be here. And my experience through this and so forth, I've come to a conclusion that is totally lost. Totally lost. And in fact, if you're going to have forums like this, let's have representatives, voluntary representatives or participants as participants, right? If we're looking for solutions, let's put the individuals with the disabilities and the needs in front, right? And say, what do we do to address the needs of this person or persons? Unless that happens, we'll be temporary. Like I say, someone comes to this, and this, that, and that, just nowhere. It's ineffective, it's inefficient, and it's costly. It costs DDA, right, for the waste or people not understanding that we are dealing with the individual needs. If you have a reviewer is looking at a piece of paper and not connecting it to my son. A real human with needs, because you get a clarification request and you say, is this
right?
Boggles the mind. That is the person-centered, needs to be defined and put on the wall at the north star. And example, the DOD, Department of Defense, their strategy documents and so forth. So they said everything we do, the DOD, is for the war fighter. The war fighter is my son and her sons and the gentleman over here and those represented here. Those should be our North Star. Thank you.
Absolutely. And talking about a North Star, the gentleman in the green shirt.
Rob, I need to speak for Rob, but I was asking Rob if he had any comments he would like to make, and we discussed it. We don't have his address today. This is part of Rob's speech. Rob, first of all, wants to express to Governor Moore how much she likes and admires him and thanks him for his support. And Robert also wants to let everyone know that he feels constantly he is fighting for the right to live in his community and for the right of other people to live in their communities. And he would like the DDA to help them figure out how to do that. Okay, yes, Robert likes to have, these are Robert's words. These are Robert's words. We are going to depend on the natural, I'll put this in my MHC. The natural supports that my husband and I are compelled to provide, even like more independence so that structure does not exist for him. And that's what's happening with my next man, Governor. I believe, Robert, you would be willing to work with the DDA on solutions to fix the problems, is that correct? But I am. So, did I get everything you wanted to know? Yes, he feels like he's really definitely.
Thank you so very much. So we are right almost at 3:10. So we're going to be, yes, I see the, Yeah, we can online. We have time for one more online.
Would that be me?
Mary Beth, does that sound right,
Yes.
Dr. Small? Yes, Mary Beth, yes, please.
Yes, I'm here. Can you hear me?
Yes, please.
Okay, good. So my comment actually takes a bit of a step backwards and to discuss the communication issues. One of the primary causes for tension is the persistent disconnect and flow of inconsistent information between the DDA, the MDH, the FMCSs, the participants, families, employers, and vendors. Stakeholders, we frequently receive conflicting and contradictory information from all parties, and often even different individuals within the same party. The lack of a unified message creates confusion, delays, and a breakdown of trust in the system. When the left hand doesn't know what the right hand is doing, it puts an undue burden on the very people that these programs are designed to serve. We understand that managing complex programs with many moving parts, but the current state can't continue. We need a clear, consistent, reliable information to effectively manage the lives and provide the necessary care and services. To effectively address this, we need a single, consistent point of authority, a designated point of contact who is responsive and timely when addressing our issues, along with a point of contact for escalating unresolved issues that all other parties from the DDA to the FMCSs are required to follow. I personally have, the FMCSs are very difficult to work with when it comes to this specific issue. We can get different answers from different people on the same day from the same FMCS. And one of the things that they like to say is per policy, blah, blah, blah. But when asked for the policy, they never are able to produce anything. And again, that builds distrust and frustration. We want to follow the rules. We want to do this the way it's supposed to be done. But every time we feel like everybody keeps moving the bar. We want to follow the rules, but we don't know what they are because they constantly get changed. Now, one other thing is that the FMCSs, if I did my job as poorly as the FMCSs do, I wouldn't have a job. And I feel like the participants should have a way to have some sort of accountability to the FMCSs. They take the money out of the budget for their monthly fees, but they don't do their job very well. And we should be able to put that money into an escrow account somewhere until they do their job and they do it correctly and they do it well. And we even have conflicting information within the webinars, which I posted all of this in the comments.
Thank you very much. So please know that everything was recorded. All comments were collected and they will be published. All right. Please also know that there's going to be 4 regional listening sessions. And the first one is going to be, is it October? See, I just had my notes. 9th? Thank you. October 9th. And the location is to be determined, and it will be 1 to 3, and then so forth and so on around the state. So please also make sure that you are spreading the word. I want to just thank everybody this afternoon for all of your comments and for really doing everything in a very respectful and kind way so that we could collect comments that could be very useful as DDA is really looking at all of this systems. So thank you all very much. Thank you for those of you that were online. Hope everyone travels safely and has a good day. Thank you. Oh, sure.